Hi everyone, and welcome to the Musculoskeletal Content Review. So this part of Exam 4 is about 10 questions, give or take a question or two, seeing as the exam hasn't been finalized yet. So let's get started. The first disorder that I would like to bring up is rhabdomyolysis. Now, to me, this is more of a trauma injury, but it also makes sense to have it in the muscle unit. Basically, what happens is, for whatever reason, there is massive muscle breakdown in which myoglobin gets released into the circulation in really high levels. Like, let's say a patient is found down after being there for like 2 days. Or with what's called a crush injury. And a crush injury occurs when just that happens. Let's say your leg gets crushed and you have massive muscle damage that ultimately releases these high levels of myoglobin into your bloodstream. So basically what this causes is, as the kidneys try to filter out this myoglobin, it causes damage. And they clog up the tubules that are filtering. And this leads to acute tubular necrosis and acute renal failure. So the treatment for rhabdomyolysis is fluid, lots and lots of fluid, because what you're trying to do is dilute out that blood. People in rhabdo will have elevated creatinine kinase levels, or CK, on labs, and also exhibit dark reddish-brown urine, and that's that myoglobin being excreted in the urine. Now, rankle, as we know, is a very important substance that helps regulate the osteoclast activity. Now, as we know, bone is kept in check by the interplay between osteoblasts, or bone-laying cells, and osteoclasts, or bone resorption cells. Rankle is one of those substances that increases bone loss. When rankle binds to its receptor rank on osteoclast precursor cells, it triggers their proliferation and increases bone resorption. Osteomalacia is another disorder of the bone, and what happens is that bony matrix doesn't mineralize as it should for a number of different reasons, whether it be malabsorption, maybe it's due to, like, as the picture states, celiac disease, medication use, liver kidney failure. But basically, these bones are weaker and don't form as they should due to this lack of mineralization. Continuing with bone is osteomyelitis, and this is how the bone responds to an infiltrative infection. So the first thing that it does is it elicits the inflammatory response, which, as all of us can imagine. Now, as the infection infiltrates that bone, it destroys part of it. And that is the sequestrum. That's a part of now dead necrotic bone. Now, due to this insulted bone, specifically the periosteum, an intense osteoblastic response is stimulated. And as that new bone, because remember, osteoblasts lay bone, an involucrum is created surrounding that area from that intense osteoblastic activity, as you can see above. One thing to remember with osteomyelitis is that it's extraordinarily difficult to treat, seeing as the caniculi to the area of infection has been disrupted as the periosteum has been displaced. So these patients typically need high doses of long-acting IV, or long courses of IV antibiotics, surgical debridement, and most likely a biopsy to get that organism to correctly dose your antibiotics. Paget's disease is a state of increased metabolic activity with excessive resorption of spongy bone and deposition of disorganized bone. The resorption phase of Paget's disease is followed by the formation of abnormal new bone at an accelerated rate. In the skull, abnormal remodeling is first evident in the frontal and occipital regions and can progress to the entire skull. The skull thickens and assumes an asymmetrical shape, and thickened segments of the skull may compress areas of the brain, producing altered mentality, and dementia. This is just straight from the book. Impingement on the new bone on a cranial nerves, it can cause sensory abnormalities, impaired motor function, deafness, atrophy of the optic nerve, and obstruction of the lacrimal duct. In long bones, resorption begins in the subchondral regions, and occasionally Paget's disease affects both ends of the long bone. In the femur, Paget produces an exaggerated lateral curvature. In the tibia, anterior curvature is also exaggerated, and stress fractures are common in the lower extremities. Now, metastatic bone tumors, say breast cancer, are actually quite common, but primary metastatic bone tumors are not. Malignant bone tumors account for less than 0.2% of all cancers, and this is an osteoblastic disease. So the most common is osteosarcoma, which accounts for 38% of the primary bone tumors. An osteosarcoma is a malignant bone-forming tumor. It is aggressive and most often found in the bone marrow and exhibits a moth-eaten pattern of bone destruction. Now, before we talked about the more common form of bone metastasis, and that is secondary, where the cancer comes from a different location and metastasize into the bone. During this workup, the two things that you want to look at are ALK Phos and calcium. The ALK Phos is found in bone diseases and increases in bone cancer as well as Paget's disease. And the calcium reflects the destruction of the bone and the calcium being released into the blood, as you remember from our oncology unit. When looking at arthritis, there are differences between osteoarthritis and rheumatoid arthritis. Osteoarthritis is the breakdown of articular cartilage, as you can see above in the picture in blue. Whereas rheumatoid arthritis is an inflammatory autoimmune process where the B lymphocytes become plasma cells producing enzymes and cytokines, causing ankylosis and destruction of the articular cartilage. The last arthritis condition is gout, and this is an inflammatory response to excessive quantities of uric acid in the blood and other body fluids that lead to the formation of monosodium urate crystals in and around the joints. As your body attacks these crystals, inflammation, pain, and redness occur. This prolonged accumulation results in joint damage to gouty arthritis. Now, that's after prolonged exposure. If it's an acute inflammation or acute flare, that's just simply called gout. And that concludes the musculoskeletal content review. Good luck, and as always, feel free to contact me if you have any questions.